Hello, this is Dr. Salim from Brooklyn, New York, about a live raw case from my clinic. Today I have my brother. He doesn't mind me filming. Yes, my brother? It's okay. My brother doesn't mind me filming. I appreciate it. Thank you. He came in complaining of a headache. Get closer with the camera. Number one, guys, you need to listen to your patient. He complained of a headache that goes here, the side, told me here and here as well, and it goes on this side more, here. So first thing you need to evaluate. Part of the evaluation, other than history taking, you look at the head. When I look at the shape of the head, if you see here, can you zoom here? Camera zooms the camera. This is like, see, for me, it's little, I would say fall, little inflated here and here. It's more fall. This is cerebrospinal fluid, guys. He's more. This side is more than this side. But if you go here, it's bigger than you're going down here, smaller on this side. This gives you something in your head, okay? We have a lot of congestion. It could be cerebrospinal fluid, could be the venous blood, whatever. Okay, if I go here, I see the mastoid. The mastoid process, we spoke about mastoid yesterday. Mastoid process here is a little bigger than the other side, okay? Okay, this mastoid, can you zoom? You see the mastoid here, guys? You can palpate. We need to build up inspection skills. We need to build up palpation skills. Don't expect it to come overnight. People have different skills. People have different talents, different gifted. The best craniosacral therapist, most famous in New York City, he said it took him 7 years with John Upledger just to learn how to palpate the craniosacral rhythm. But now, because he's patient for 7 years to learn, now he's one of the leaders. Okay, anyway. Now here, the mastoid here is bigger, okay, guys? So what tells me if the mastoid is bigger? I mean the sternocleidomastoid, okay, and the muscles are pulling more here. Could be more spasm in this side. That's what's giving him the pain here and pain in this area, okay? Then I'm gonna go outside here. This is smaller. Okay, first what I'm gonna do, I'm gonna palpate the sternocleidomastoid on both sides. When I palpate the sternocleidomastoid this side, see, it's hard. It's bigger, it's hard, it's hardened. Whatever the tenderness or no. He doesn't have tenderness because people have different degree of pain tolerance. My brother could be, he's a pain tolerant. He doesn't have a tenderness, but it still is more spasm, it's tight. Not only sternocleidomastoid, has also spasm here and the sternocleidomastoid, the scalene as well. I go here is very soft. So what I should do here, I need to relax the sternocleidomastoid, and I showed you yesterday how to relax the sternocleidomastoid. That's number one. I already did it in a video that I showed yesterday in the case of neck and shoulder. Now let's go back to the headache. How can I treat? First, we need to relax the sternocleidomastoid here. The second, more important thing here, and I want to tell you, check the space between the C0 and the C2. There's enough space or no? For him, when I checked him sitting first, was a good enough space. See now? Now, okay, what I check here? When I check here, can you go there or hard? Okay. Can you go there, zoom there?
Yes.
Anyway, the right occipital condyle is lower, is more caudal than the left occipital condyle. Okay, how am I gonna correct this myself, as Dr. said? Bring your right knee up, my brother. Put your right knee to chest, please. Right knee. Pull it with the hands to chest. Pull it up more. Relax. Put your head down and rest, brother. Put your head, leave your head in my hand. No. There's not a head in my hand. I want you to relax. Please leave it there. Okay, now, as soon as my brother took his right knee up to the chest, to the shoulder, the right occipital condyle that was caudal in relation to the left, it became more cephalic. Okay, now is overcorrected. And usually when you correct some bony deformity or bony abnormality or bony malfunction. Can you change the angles? You can change. Okay. The bony malfunction, what you need to do, you overcorrect like 120% because it has tendency to go back what it was. When you relax, it's going to be to the 100%, to the normal correction. Bring it a little bit up, my brother. Just now relax and leave it for me. Just relax. Put your leg down. Okay, now when he put his leg down, now it's still corrected 110%. Okay, even just by moving his leg. So I try to normalize the occipital condyle. This is number one. Number 2, check the space between the C2 and C1. Now the space is more bigger now. It's much better now, okay? By just moving the hip and stretching the hip. Okay, what if I want to increase the space on both sides? Little more. I ask him to do both knees up. Take one knee, take the right knee up, please. Right knee up all the way. Stretch it. Okay, can you bring the left knee as well? Great, bring it more. Perfect, now relax, brother. Fully relax. Okay, just fully relax, please. Fully relax, fully relax. Okay, little more for relax. Okay, okay, little more, please. Little more. Can you pull more? Can you pull higher? Higher, 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 higher. Pull higher, 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 higher. Wow, pull higher. Okay, guys, the space was not increasing after he did a little bit. Before showing his leg. Only the space between the C0 and C2 started increasing only after I asked him to pull more and higher. So when you work, don't say I tried and it didn't work. You have to be sure that you're doing the right thing and the right amount, right quantity. Pull more, brother, because my brother is like, let it be like me, has let it be a belly. Okay, pull it out. Like, because your belly bother you, just pull up. Yeah, open out and pull. Wow, this is now great bigger space here between C0 and C2. But notice here now, because the right occipital condyle was lower than the left one, and I tried to normalize. When I asked him to pull both knees now, still the right one is a little lower. Little caudal. How to normalize? I'm gonna ask him to pull both, but I want this more. Can you pull this with the right more? Right more, right more, right more. Good job, my brother. Now is corrected 110% and normalizing the condyle space. Moving the space between the knees. He's tired. Bring it down, my brother, now. Relax. Okay, what else can help? If you ask him to alternate knee flexion, both sides, right and left, right and left, right and left. This can help. Okay, now I'm increasing the space now very well between the C0 and C2. That's great. This number 1, you'd have more space there between C0 and C2. Number 2, you need to look at the C2 Spanish process. My brother says it's tender. Is it tender here, my brother?
Yes.
Okay, this tender. Okay, how gonna fix this? I'm gonna show you how to do based on Lawrence Jones technique, 120 years old technique. Okay, plenty of research is done. This is standardized, as I said before. Lawrence Jones is standardized in American osteopathic medical schools, both the public government schools and private schools. Okay, for Lawrence Jones, for posterior C2 Spanish process tenderness, either you do flexion or you do extension. But for my brother, I'm gonna do flexion, because the flexion is gonna help me increase the space between C0, which I accept, and C2. But what here too, he has pain and the back here. Sometimes he has also tenderness and the right splenius muscle.
Yeah, right.
Okay, when I do flexion here, I'm gonna stretch the splenius muscle. I'm gonna go